Alrighty, so we're going to be doing heart auscultations. First thing you do is you wash your hands, all clean. Make sure your patient's in a gown. It's all good there. And then you go into inspection. You look for any precordium or protrusion in the chest. I blanked for a second. Any protrusion in the chest. And then also, after that, he's all good, It's just normal. So next thing we're going to do is we're going to go through the auscultations of the heart. So the first one, so you start off with the diaphragm first. You put these in facing forward. You want to tap, make sure you're using the right side. So then you start on the right second intercostal, which is right below that second rib, and then you're listening to the aortic valve. What you're listening for is any abnormal beats, like something like skipped or something like that, murmurs. The next is right across, and the second intercostal on the left side, looking at the pulmonic valve. Then you go into Erb's point, which is at the third intercostal. Then you go to the tricuspid valve, which is in the fourth intercostal. And then next you look at the mitral valve, which is the fifth intercostal, and you gotta go up and under. Yeah, so that's all normal. When you're using the diaphragm, you wanna have good pressure on it. When you're using the bell, which we're about to go to now, gotta flip it over, tap, make sure you're on the right side. And then with the bell, you wanna use a lighter pressure to hear that softer sound. So you just go in reverse with the fifth and to the fourth. Alright, and the next thing is you're going to check their carotid artery. So we'll use the diaphragm first. Feel for that artery and put it there. And with that, you're just kind of listening to their heartbeat, and then we're going to switch over to the bell. And then, yeah.